Greetings. I am Syrai Lovelace, a senior biology major at Fisk University in Nashville, Tennessee, and today I'll be talking about infant mortality in Tennessee. My research focused on this question. Does a virtual educational intervention improve knowledge and awareness of infant mortality risk factors and prevention strategies among college students? My hypothesis was that participants who completed the educational session would show increased knowledge and confidence compared to their pre-test scores. This is important because education can play a key role in preventing infant mortality, especially among young adults who can influence their community. Infant mortality remained a major public health concern, especially in Tennessee. According to my research, Tennessee infant mortality rates was 16.1% higher than national average in 2023 and has been steadily increasing since 2016. There are also significant racial disparities within infant African American infants being disproportionately affected. Many of these deaths are linked to preventable factors such as unsafe sleep practices and a lack of awareness of health resources. Because of this, education and early intervention are critical. I chose to focus on college students because they are in a position to spread knowledge and influence future behaviors in their community. Through this, I had hosted this intervention. This intervention is a single session pre-test slash post-test intervention. This is the flyer that I used. Participants were undergraduate students between the ages of 18 to 23. I had over 40 participants who attended the intervention. The session was conducted virtually via Zoom. I used Google Forms to assess their knowledge before and after the intervention, and the goal was to compare the pre and post test scores and measure how much the participants had learned from the intervention. The overview from the intervention was that during the session, I covered safe sleep practices using the ABC method, sleeping alone in your bed, sleeping on your back, as well as sleeping in a crib, opposed to sleeping in the bed with your parent. I also talked about leading causes of infant mortality, key prevention strategies, and community resources, including services from the Tennessee Department of Health. I also encouraged discussion and used visuals to help participants engage and improve their knowledge retention. The results showed a clear improvement in knowledge and confidence. The average score increased from 2.73 to 4.15 out of 5, which is a 52% increase. The confidence level improved significantly. Before 75% reported low to moderate understanding of infant mortality, and after there's 80% that reported a high confidence. Participants also showed stronger understanding in safe sleep practices, preventable causes of infant mortality, health disparities of social determinants of health, as well as maternal and community risk factors. Overall, the data showed that the intervention was effective. My conclusion is that overall this project showed that a virtual education intervention can significantly improve knowledge and awareness of infant mortality. The participants left with a better understanding of risk factors, prevention strategies, and available resources to use in the future. Moving forward, this type of intervention can be expanded to a larger group, implemented in schools and community programs, as well as adapted for different populations. Ultimately, increasing awareness can help reduce preventable infant deaths and as well as lower the infant mortality rates in Tennessee. I would like to give acknowledgement to Fisk University, Meharry Medical College, Kristen George, which is the person who is my speaker for my intervention, Christina Haygood, who is my mentor for this program, as well as the HUCU Wellness Project, and my resources is below. Thank you.